Hello, my name is Ian Peace and welcome to the first of a series of webinars that I'm doing for dentinal tubules. I've got to say this is somewhat strange, sitting here in my flat talking at a computer screen. I'm used to lecturing to people in a room and I get feedback, so I'll try and keep this as interesting and as lively as possible for you. Bearing in mind I'm talking at a screen. What are my series of webinars about? Well, I'm a specialist in periodontics, and so this series of webinars will be effectively about periodontics, but also seeing as I consider dental implants as part of the periodontic repertoire, I will be discussing dental implants as well. This first webinar is going to be a discussion on some of the basics of periodontics, looking at things like diagnostics and risk factor analysis, and it will set the scene for future webinars. So this webinar will last approximately half an hour or so and lay some seeds for future webinars. For those of you that know me, I'm not averse to a little bit of controversy, so I will be throwing some controversial thoughts into the mix, really for the sake of discussion as much as anything. But I think it's important to constantly question what is happening in the world of dentistry, and in light of new evidence and thoughts, reconsider our approach to clinical dentistry. So, who am I? Well, as I mentioned a moment ago, my name is Ian Peace. I'm a registered GDC specialist in periodontics, qualified in 1985, and over the years I have pretty well experienced most areas of dentistry. I started off in NHS general practice, but quickly moved on from there, as I can't say I particularly enjoyed it. I've worked in specialist private practice, I've worked in private practice as an associate, I've taught in dental hospitals. So you can see I've got a wide range of experience. I'm effectively a clinician, I'm not a research scientist, so everything that I discuss is really from my own clinical experience. In 1999 I completed a short fellowship program in dental implantology and bone grafting at the University of Miami, and shortly after established a specialist referral practice in Nottingham that I ran for quite a number of years and built it up until recently selling the practice. So today, thoughts about perio and implants, and this is simply the beginning. It is obviously a webinar of maybe 30 to 40 minutes, so sadly I can't cover everything in detail, but I'm sure at some stage in the future there will be opportunity for questions and answers. Luckily we don't see too many dentitions like the one in the picture. This was a photograph taken in China, where perhaps the dental care is not as well established as in the UK, but sadly I do see situations like this and some pretty advanced cases, sometimes requiring clearance and provision of bone grafting and dental implants. Much of the work that I do now is based around prevention, because I'm a massive fan of prevention. It's sadly not a main item of dental or even medical agendas, but to me prevention is the key, and it's something I'm trying to promote, and hopefully my series of webinars will promote prevention to a wider audience. But this is the sort of thing that I see on a fairly regular basis. Now, this is a gentleman that I treated well over 10 years ago now, who I still see, and as you can see, pretty impressive restorative work performed many years ago. Excuse me, I do have a bit of a cough today, so I'm afraid you might get the odd little splutter from me. I'll do my best to keep going through it. But you can see the upper left canine tooth, regardless of the rather deficient margin, should I say, has evidence of periodontal disease. And indeed, when you probe this area, or when I probed this area over 10 years ago, there were 14-15 meter pockets with bleeding and pus, and in fact I was almost up to my elbows in this situation. So I had a long chat with the patient and explained to him the prognosis, and really what I was initially looking at here was a clearance with bone grafts and potentially full arch dental implant care. However, this gentleman was not terribly keen on that approach, and I will explain to you later how we approach this, because we have some very interesting radiographs and it's a nice discussion point. So I'm going to put this case on hold for a little while and come back to it later. So what else comes into the practice? Well, as you can see, periodontal disease comes in all sorts of shapes and sizes and forms, and with varying degrees of prognosis. Now, the reason I put these 3 slides up is because I think they're interesting from a prognostic point of view. The case on the right is a rapidly aggressive form of periodontal disease. The one in the middle is a more chronic, slowly progressing form, and the gentleman on the right not only had periodontal disease but also some severe restorative issues. So when I'm lecturing in front of an audience, I ask the audience what they think the prognosis is for each particular case, and I get varying levels of answer. But to cut a long story short, the case on the right, I placed a questionable prognosis on this particular case because it was an aggressive form and in a younger patient. The middle case I actually placed a good prognosis because although there is evidence of periodontal disease and hard deposits, the probing depths were not severe. When I say severe, I mean advanced, and also some of the periodontal disease has been already rectified by recession. So in the middle case, it was a case of instituting thorough